Mimicking nature. Maxime, what is new and revolutionary in the field of veneers and cosmetic dentistry for you?
First of all, thank you very much for these kind words. Sometimes I think you're exaggerating. I'm just a regular dentist from Ukraine, and also thanks for coming. It was a surprise for us that Miguel joined us today for this course. As for revolution, it's a very difficult question actually for us. Because we try to be closer to the nature, and despite the fact that we have a lot of materials and technologies nowadays, we have no idea how to reproduce the nature for 100%. So I think that the revolutionary in present dentistry is the techniques that allow us to preserve two structures during operating dentistry. If we will use the microscopes, for example, or high magnification, we can be precise in order to keep nature.
Because we see that you're part of the microvision group. What is this group exactly? What is your philosophy?
This group is actually focusing on the minimally invasive dentistry, and for sure we are applying the techniques that allow us to be real minimally invasive. We're using microscopes, we're using loops, and we try to implement these techniques to preserve the nature. This is the group about the minimally invasive dentistry and passion.
So
in this field,
I think that one of the most important things not to lose focus for any dentist out there today, because we have a lot of young dentists, veteran dentists watching here, is, as you say, imitating nature, and this minimally invasive seems to be the big word of the day. When, in your opinion, do you think dentists have to prep more or prep less, or can you always do minimally invasive dentistry?
Unfortunately, no. Nowadays we have no this possibility to prep less, but not because of us, not because of our skills or our knowledge. It's because of our patients. Because sometimes there are a lot of clinical cases that should be done before the restorative treatment with orthodontists, for example. And I don't know how it goes in Portugal, for example, but in Ukraine we have a lot of patients refusing to do this treatment with orthodontists. In these kind of cases we have to be more aggressive, for sure. But if the case will be mine, for sure I will go directly to orthodontist, and then I will get the minimally invasive treatment from the restorative dentist.
Mimicking nature as much as possible. Dr. Maxime Belograd,
thank you very much.
So much. So wonderful to be here.
Thanks. Можешь теперь